All right, again, thank you all for joining the session. We are excited to have a conversation with George Spiers and Thomas Charlton to talk about Citrix Health Checks. And this is something that has been increasingly becoming a hotter topic for us. So we've got George Spiers joining us today. He is a Citrix CTP UC architect. He's also certified in Epic, so he's ECSA certified, and he happens to be one of the co-developers of the automated Citrix Health Check module. And then we have Thomas Charlton joining us as well, and he's the founder and CEO at Goliath Technologies. He's also an industry veteran in the healthcare technology space, so should be some really good conversation. In the background, you'll have myself, who leads product marketing, and Avi Lip, who leads client success. So you've got a full crew on the session today. Just a few housekeeping items before we get started. If you have any questions, and we want this to be an engaging session, if you have any questions in your GoToWebinar tool panel, there is a question and answer pane. Go ahead and click on that, and you can type your questions in there. We will try to get to every question we can. If you type it in and it's relevant to something specific that we're talking about in real time, we're happy to try to get those in there as well. So just leverage that, and we will try to get to all the questions before the end. In just a minute, we're going to kick off with just a quick poll, just to kind of gauge sort of the landscape for everyone. And then at the end of the session, after the webinar ends, we have a brief survey with a little bit more information. And it just helps us to make sure that the sessions are relevant to you all and what we can do to improve them. As far as this session, like I said, we're going to kick off with a quick poll, then we're going to jump right into the content, talking about automating the Citrix Health Check process, what the challenges are and what the solution is. And then we're going to jump into an actual demo. You'll get to see it in action, what it looks like in real time, and then we'll take some time. We have a significant amount of time at the end set aside for Q&A. So definitely, if you've got questions, make sure that you're putting those into the question and answer panel. All right, so to get us started, we're going to launch a quick poll. Give me just one moment. It's a very simple yes or no question. Do you have a Citrix Health Check planned for 2025? I said it's a simple yes or no. Actually, there's a third choice. You are considering it. All right, we'll give it just another second. Okay, we're going to close it. We'll share the results so that we can see where everybody's at. Looks like about 10% of you do have one planned. A little over half of you are in the consideration process with it, and it looks like there's about a third of you that aren't considering it, at least until after this session. All right, so thank you. I appreciate you taking the time to answer that poll. All right, we're going to go ahead and jump in right into the content, talking about automating the Citrix Health Check process. And I'm going to bring Thomas in. He's going to give you a little bit of the sort of the, I'd say history, it's not a long history, but sort of the origins of why this has become an issue and why we're working on addressing it and solving these problems for you. So Thomas, all you.
Sure. Thanks, Gary. So when we think about taking a step back, for those of you that don't know Goliath, our technology is designed to help IT pros be able to anticipate issues before they happen, troubleshoot them quickly, and then document the root cause of end user experience issues, so productive conversations can be had with vendors, other departments, so permanent fix actions can be put in place. And we do this not just for Citrix, but for VMware Horizon and any other DaaS solution, whether it's AWS, Workspaces, or AVD. Relative to Citrix, you know, the whole notion of an automated Citrix Health Check came out of a conversation I was having with George Spiers. We had a client of ours that wanted to do a Citrix Health Check to make sure that their Citrix environment was totally optimized and configured in accordance with best practices. when they were telling us the story, what they were concerned about was that they had just gotten through a situation where it took them days to troubleshoot an issue, and they found out that the issue was a result of a setting on their Citrix environment that was not configured the way it should have been. Okay, so the setting changed through some sort of an upgrade. I'm not sure exactly what, but they said this would have been solved if we had a Citrix Health Check, and we'd like to have one. Do you do those types of things? And we said, no, we don't, but we have a series of consultants we worked with. And I picked up the phone. George and I got on the phone, and we started talking about this. And as we were talking through it, we were talking about how he goes about about a Citrix Health Check. That he checks not only the Citrix stack, but he also checks the supporting infrastructure. And it was during that conversation, and I believe with one of our tech folks, that I said, boy, is there any way that we could get our technology? Because when you deploy our technology outside of the Citrix Health Check, we're automatically checking for over 250 events, conditions, and failure points in the Citrix environment and the supporting infrastructure that we know impact end user experience issues. So I know that our product can do this from a feature functionality point of view, but not being technical, I wanted to test it out. So George and I were able to get on with product management and development, and that's where this whole thing took place. Because when I was talking to George, we were talking about the cost, the time, the fact that it's kind of an event, you know, a snapshot, or excuse me, a health check is done once a year or something like that. So it's an event, and all of the configuration that takes place you can lose the value over the period of 12 months, right? Changes happen, things have to be reconfigured, etc. So that's where the whole idea of the health check came about. So George, thank you for helping us through this, and also to our product management team. But we're really, really excited about the fact that we're able to take something that was typically a manual process, very costly and event-based, and make it part of a continuous check to make sure that your Citrix environment is always optimized.
So Thomas, you want to go into a little bit about just high level what the health check module provides?
Yeah, so as we were saying when I talked to George, there were a couple of different aspects of the health check. And so when we designed, we looked at sort of the challenges with health checks, and we used that to inform the feature and functions of the product. So when you deploy the technology, we do an immediate health check. So we do an assessment as if you hired a consultant to do it, only it doesn't take, you know, days or weeks, depending on the size of the environment. It's happening automatically and very, very quickly. So the product deploys, and it's conducting a health check. You'll get back from the health check a report that'll tell you what's out of compliance, and then moreover, George has worked with us to tell you how to get back in compliance. So we're not just going to tell you that something's out of compliance. We're going to give you the instructions you need to be able to pull your Citrix environment back into compliance. And then instead of being an event, and this is really, really cool, instead of being an event, we're going to automatically check your environment on a continuous basis. Now you have complete control over this. You can say, run a health check for me every month, every week. And then we'll send alerts when things are out of compliance. So it's like you have hired an IT professional to be constantly checking your Citrix environment to make sure it's compliant, because there are so many things that can go wrong when you're trying to deliver a good end user experience. We might as well make sure that the Citrix environment, which is generally what's in our control, is completely optimized.
Okay, great. It sounds like just the conversations you've had with George, the conversations that you've had with customers, there's a real pain point here. I know that just in my conversations that I've had, health checks a lot of times sound like they're a nice to have, but because they're costly, they're time consuming, there's a real blocker here. I want to bring George into the conversation. George, we're obviously coming at it from a software perspective. You have a different perspective, right? You're coming at it from a consultant's perspective. So most of the folks on the call who have participated in, who've conducted health checks in the past, likely have leveraged a consultant like yourself. So can you share some of your experiences about what it's like, observations, user stories, whatnot, what it's like to, from a consultant's perspective to conduct these health checks?
Yeah, I certainly can. And thanks, Kiri and Thomas, for the introductions and background. So yeah, as you mentioned, I've run many health checks for customers, and they're manual health checks, let's say. And when I mean manual, you go in, you discuss the scope of the health check with the customer. So what's in scope, what's out of scope, and then you perform the health check. After that, you write up a report of your findings. And often you also get involved with helping out with the remediations. A lot of times the customer doesn't want to remediate without your assistance, so you get involved in that as well. And as Thomas mentioned, it's an event. It's a point in time, and I will explain what I mean by point in time on the next slide. But since it is point in time, typically organizations will have to re-engage a consultant like myself yearly, because after 12 months since the last health check, we have new software updates that are released by, like Citrix or Microsoft, or maybe the organization has brought new use cases, new users into their existing Citrix environment, or maybe they've deployed new technology. So the recommended best practices are always changing, and that obviously warrants another health check to be performed in the organization. And another observation from my experience is that health checks should be viewed as an organization that's taking preventative measures. And what I mean by that is, if your Citrix environment is optimized and configured as per the vendor best practices, then in theory, it's less likely for that environment to experience issues. And this is true. And if I sort of give an example, if you deploy, let's say, Citrix Cloud connectors and you completely undersize them, then you're really asking for trouble. And that's just one simple example. So doing health checks is making sure that you have your house in order, so to speak. And health checks aren't necessarily focused on fixing existing issues that are happening right now, but there are times when a health check will resolve existing issues. And I'll give that an example of that on the next slide. So, in this slide, I wanted to discuss a couple stories that I've had from my previous health check engagements. And it's just to give you some real life experience from me being a Citrix consultant, who I guess you can say has been there and done it. So, the first story I want to discuss is, an organization that I performed a health check on their environments. Well, that organization was acquired later, and it was actually within sort of 12 months of the initial health check that I did for them. But all of the users from that organization moved across to the acquirer's Citrix infrastructure. So this effectively meant that the Citrix health check that I had done for them, it had to be run again in the acquirer's environment. And for obvious reasons, that's one, time consuming, but it's also costly. And this is why I thought, along with Thomas, there must be a better way of doing or performing health checks and using things like software automation. And that's obviously the reason now why we're discussing the concept of automating Citrix health checks. The second story that I can tell is the
George, can I pause you just for a moment, because we have had a couple questions come in,
okay.
and tied specifically to what you've been talking about so far. So I wanted to kind of get those in real time. One question came in, said, if they have multiple Citrix farms, can a health check cover each one individually?
Yes, absolutely. Yeah, we can cover multiple Citrix environments. That's fine.
And then there was another question. I guess they had a similar situation, went through an M&A, they were acquired. I'm not sure if they were on the acquiree or the acquired side, but Their question is around their organization's Citrix Cloud. So maybe they didn't have Citrix Cloud before. Does the health check module support cloud?
It doesn't. It does certainly, yes. So the Citrix Health Check will cover Citrix Cloud components such as the Cloud Connector, and also other components that a typical Citrix Cloud environment will possess, such as Citrix FAS, and then of course all of the session hosts or Citrix VDAs that an environment has.
Okay, great. And just a reminder to everyone on the session, if you've got questions, go ahead and type them in. As you can see, we're going to try to take them in real time if it's applicable to the topic. So George, sorry, carry on. User
Perfect.
story 2, you're gonna start.
Yeah, no, thank you. Yeah, the second example I had that I wanted to discuss was there was an organization that approached me. They were having extreme login slowness, and it was actually having a financial impact on their organization. So right away, I said to them, hey, let's do a health check. And like, I can't tell you the amount of misconfigurations that we found as a result of the health check. But most importantly, in the context of the extreme login slowness that this customer was experiencing, we uncovered as part of the health check a badly designed profile management solution. So what we did was we addressed it through a remediation plan, because that's typically how the health check will go. You do the check, then you come up with a remediation plan. So after re-architecting their profile management strategy, the customer logins were reduced. It was dramatically reduced. And actually the customer came to me, they sent me a mail to say that their own users had been giving thanks to the IT department, which of course is rare. I think we can all agree that it's quite rare for users to thank IT when things are going well. It's you normally hear from users whenever there's problems, right? And that's it. But this event and this story, it really highlights purely the importance of a Citrix health check. So for anyone that's not doing health checks today, or maybe anyone that hasn't done a health check in a couple of years, this does highlight that importance.
Yeah, it's interesting because it makes you think, because you're right. We've even had some comments come in, very rare, that users will compliment IT, but it makes you wonder just how bad were things that it compelled users to actually reach out and thanks to the IT department.
Right.
A question that did come in on this topic, you were talking about profile management. Does the module only support Citrix profile management?
Yeah, the Citrix health check module supports Citrix profile management, but there is another module, the FS Logics module, which will cover FS Logics. So if you're not running Citrix profile management, you can be covered by the FS Logics module for those customers that are running FS Logics.
Okay. And then, sorry, go ahead.
I was going to say, George, of the people that responded, a number of folks are thinking about a health check in 2025. What's the typical process you go through, just out of curiosity?
Yeah, so firstly, you have a sort of scoping conversation with the customer, because one, the consultant needs to understand the environment to estimate the cost and also the effort, and also to agree with the customer what's in scope and what's out of scope. So that all happens first. Then, of course, the consultant and the organization will agree on the scope of work. Then the work will commence. So the consultant typically will get remote access into the environments. The customer might want to lead the review via Teams, but I mean that preferably the consultant gets remote access. Again, that can take 1 week, it could take 2-3 weeks, depending on process within the organization. Then that's when really the key part of the work happens, is when the consultant gets into the environment, they start to review all of the different components and configurations, and the findings are then highlighted in a report, which is sent to the customer. And off the back of that report, a remediation plan typically will be developed, where there will be a priority order of remediation. So you'll have critical items, ones that are most important to address. Then you may have medium and low priority, and the consultant and the customer will agree to go through those remediations. Now, the customer might want to do the remediations, or most of them, if not all themselves, but more often than not, I find that the customer or the organization will bring in the consultant to actually implement the remediations.
And I know this is going to vary depending on the size of the environment, but in general, what are we talking about in terms of this whole process?
I think you could say at least, on average, typically 3 to 4 weeks.
Okay.
From initial conversation to report and remediations, that would probably be, I'm probably underestimating it, to be honest. You could be somewhere in the region of 4 to 6 weeks when you factor in the remediations.
Sure. Okay. Sorry, Kerry, go ahead.
No, that's good. Good dialogue.
Yeah.
George,
one thing I didn't mention, sorry, is on the remediation side, the consultant has to work around the organization's change control process, so that can considerably delay the implementation of remediations. Sometimes customers will only accept remediations being implemented, for example, on a weekend outside of business hours. So of course, if you had, let's say 40 remediations, you're not going to do all of those in one weekend because that's too much change. So you might be splitting them out across multiple weekends, which could, of course, then cover multiple months.
Got it. Okay.
And this conversation is actually good because there's another question that came in, but just to provide some contrast to that. So George, wow, 3 to 4 weeks, and that's a little bit of a time commitment. Contrasting that with an automated module that, if you already have Goliath, is a matter of minutes to be able to set up and get running. If you're net new and you don't have Goliath, it could take a couple hours, but that still, you're talking a couple hours versus multiple weeks to get that up and running. But there was a question that came in that sort of ties into this. It's around, what about issues that the health check doesn't pick up? So it sounds like maybe there's some existing issues that they're aware of that wouldn't be necessarily tied to a setting or configuration. With that, and to what I was saying earlier, when you're getting the health check module, you're actually getting the whole Goliath suite. So the health check is one component of it, where you're looking for Citrix settings and configurations, and making sure that they're aligned with best practices. But as Thomas mentioned earlier in the call, for those of you that aren't familiar with Goliath, you're getting a software with embedded intelligence, with AI that's automatically looking for 250 plus events, conditions, failure points to help you to anticipate issues before they happen, to be able to troubleshoot them quickly with metrics that you're not getting from any of your other tools that are part of your observability stack, and the ability to document the root cause of issues so that you can put permanent fixes in place. So that's all part of the health check, what you would get with the module if you don't already have Goliath. So I just wanted to kind of point that out because the question, I think, is relevant. George, you had said earlier, a lot of organizations, you want them to look at this as a preventative measure. It's not necessarily, health checks in general, not the module itself, but in general, are not necessarily for solving existing issues. They're for preventing issues. Of course, they do help you solve them if the issues are related to a misconfiguration, but there's a lot of issues sometimes that happens outside of that. So I just wanted to kind of address that since we were on that topic. All right, George, you had a third example that you wanted to share as well.
I did, yeah. The last one was a customer. They had engaged a professional services firm, and the objective was to upgrade their aging Citrix environments. But, as part of the requirements validation, it was discovered that, and this was right at the start of the project, it was discovered that the customer was running on outdated and unsupported hypervisors. I think they ran VMware ESX, and it was outdated and, of course, unsupported. So this was found right at the start of the project, which of course is not ideal. And what it did was added more cost, which wasn't budgeted for from the customer's perspective. And it also added delays to the project because now the customer had to address this unsupported issue before they could continue with their Citrix upgrade project. Now, if the customer had a way to run, a continuous health check in their environment, then they could have discovered this much earlier, way before the project began. And that would have given them much more time to address it. And it also wouldn't have been a surprise, with a key part of their project in terms of upgrading their Citrix environment. So, the Citrix Health Check module, it performs a number of different checks, and it's looking for unsupported and outdated components that sort of help you stay on top of, the continuous life cycle of software upgrades, because Citrix, for example, they release new versions of CVAD every quarter. So it's a massive burden on an organization to always constantly run the latest software. And, Citrix is just one piece of the overall architecture. So yeah, it's super important, but that was the last story that sort of I had to share there.
George, what are some of the things that you commonly find in outdated Citrix environments?
Yeah, probably number one is the Citrix VDA software, or the virtual delivery agent. I've seen customers run all sorts of different versions. There is no uniform version. They could be running 5 different versions, and maybe 2 or 3 of those are outdated and unsupported. Another product is Citrix Workspace app. And I think organizations have a really tough time with Workspace app, because with bring your own device, users use their own desktops where IT don't have any control over those. So those would be sort of the main runners for components that are outdated. But we also have things like a hypervisor, as I mentioned, ESX, for example, being out of date and unsupported. Even things like VMware tools that run on the Citrix VDA, I've often found those components to be unsupported or outdated and having vulnerabilities as well. But, as I mentioned, it's so time consuming for organizations to keep all of these different things up to date. But you got to address it. You can't just walk away and let a version stay that way, because, it's only going to cause larger headaches down the line, because these software versions become so out of date that you start to get instability into your environment. You have security vulnerabilities because there's loopholes in the software, and it could even impact the end user experience. So luckily we have a way to help organizations that struggle to keep up with all of the different software versions, because we know Citrix expertise is short. There's not a lot of Citrix experts in the world, but we can offer tailored packages that proactively keep key Citrix components up to date under some sort of managed service. So if that is of interest, of course, do get in touch.
Yeah, and you just received some validation in the chat. Someone chimed in and said, yep, I do agree. People still use the ancient Citrix receiver. And if they're using receiver and not Workspace app, that of course is, the first red flag. That's not supported end of life already. So yeah, definitely some validation from the folks on the call as well. All right, we're going to shift gears now a little bit and actually start digging into the tech itself. So I'll give you just a quick overview of it, and then we're going to bring Avi in and actually jump into the technology in the lab. So the way that the automated health checks work is it begins with just the deployment. So you're deploying pre-configured health checks into your Citrix environment, and so you can think of all of these pre-configured checks as looking for future troubleshooting tickets that are tied to misconfigurations that never have to come to fruition, because you're going to find them and fix them before they actually happen. And then after the module is deployed, then it starts checking for settings, for configurations, anything that falls outside of Citrix best practice thresholds. And this is, as Thomas mentioned earlier, this is not just a one and done check. This is something that can be done continuously on a regular cadence. So if any change occurs in your environment, they're caught before they become a problem, before they impact the end users. And so as the module then is performing its checks, alerts are then generated. And when the checks identify settings that fall outside of best practice thresholds, the alert isn't just an alert, it actually comes with resolution instructions. So there are options to leverage automation. So if you wanted to leverage automation for remediation, you can do that. But if that's not something that's ideal, maybe you're a little bit reticent to have things, settings corrected on their own, you're provided with resolution instructions. So you understand exactly what needs to be done to fix the issue. So this means you don't necessarily have to have deep Citrix expertise to resolve the problems that have been flagged. You could even, if you wanted to, you could leverage a third-party consultant to help perform these resolution tasks. But again, you're provided everything you need to have to be able to handle it in-house with the expertise that you have on staff. And then we're providing reports that displayed failed checks. Again, the reports will also have the resolution instructions in there as well. And the reports will also include industry-only end-user experience health check reports as well. We'll talk about those in just a few minutes. But remember, unlike a typical Citrix Health Check, this is an automated module. So it's providing these ongoing checks and alerts. It's not just a one-and-done sort of point-in-time situation. When it comes to the details and how to resolve, I told you that the alerts come with resolution instructions. We're providing those detailed, broken down view by failed check along with the instructions for how to resolve that issue. So this is super useful if you're the person or if you're part of a team that's tasked with actually performing the remediation. So you don't have to go through and try to identify how to resolve the issues. You know there's an issue. You're told now what the instructions are for resolving the issue. Now you can get to resolution rather quickly. And what's truly unique about the module is, again, our ability to provide end user experience health checks. So we're showing you how your end user experience has been impacted by the health of your Citrix environment. So you could even, if you wanted to, compare the experience from before you run a health check and you run the health check, you identify issues, resolve the issues, run the report again, and understand what the impact of doing the health check had on your end user's experience. So this is great for providing or for proving success after you complete the health check, but it also illuminates the importance of maintaining an optimized Citrix environment by seeing tangible impacts, something that's empirical on the impact and the effect on end users. But these are just some slides. This is boring. We want to get into the actual technology itself. So with that, I want to bring in Avi and have him come in and give you a little bit of a sneak peek as to what it looks like. So give me just a moment to kick it over to him.
Great, thanks, Gary.
All right, there we go. Looks good.
Awesome. All right. Hi, everyone. Thanks for joining us today. As far as for the Goliath Citrix Health Check module, I'll just run through the different stages that were just discussed and how it actually looks within the technology. So first off is deploying the Citrix Health Check module. This includes importing the module to within your Goliath console and then applying it to the subsets or the entire Citrix environment that you would like to monitor or have the health check be conducted on. What will happen is there'll be dozens of different specific checks that will be executed and looking for various conditions across the entire environment. Those checks occur, and then as far as the next piece of it would be to send any alerts. So let's say, for example, you receive an alert notification that the VDI high performance plan check had failed. At that point, you will receive an alert notification if you would like to, via email or through a ticketing system, whatever works best for you. And from within that specific alert, you will receive details of what exactly that health check was taking a look for, and then also recommendations on how to be able to remediate that particular issue. So as far as resolutions, we're not just telling you you have an issue, we're telling you where to go next to be able to then resolve the issue. Curie did just send out or shared a report that will also be able to be sent out as well. So say once the entire health check has been completed, if you'd like to receive the report where it includes items such as the specific machines where those faults occurred on, the frequency of when those faults occurred, and then also the resolution notes, you will have that all in a nice report that will be able to cut down on the time to resolution for those items. Now, in addition to those specific reports that Curie had shared out, a common way to have this type of health check module be implemented is to actually first run a health check or a user experience report. In that particular scenario, before you deploy the module, you're able to get an overall user experience score as a baseline for the environment prior to running the health check. In that scenario, you'll be able to get an overall user experience score as well as a plethora of different critical metrics that impact user experience and also give you some insight into which users are having a poor experience.
Looks like we might have lost Avi briefly. But while we're on this what you're looking at here is the end user experience scorecard. Across the top, you'll see various scores, and what they represent is what your users are experiencing as compared to industry best practices, which is really, really helpful. And so on the lower portions are the details. So not only, imagine this, you're able to see at a glance, you're able to see of all without them self-reporting, what users are having a poor experience, with what frequency, the duration, and then it's correlating that with potential root causes, right? So is it from a particular location? Is it a particular workspace version? Is it connection speed, network latency, etc.? So we tell you if you're having it, who's having issues without them self-reporting, which is pretty cool, right? So many times from a Citrix perspective, we're many times in a Citrix scenario, we have a challenge, which is, we'll get people complaining, and we don't know how to frame up the size of the issue. We'll also have situations where we get sort of sideswiped by somebody complaining to exactly the right person or the wrong person, depending on your opinion. And you get, it sounds like everything is happening at the same time poorly. So we frame up how big the problem is. Is it broad or is it just loud? And then give you details so you can actually troubleshoot the issue.
All right, looks like Avi's still having some difficulty getting in, but that's okay. We have a ton of questions that have been coming in, so there's plenty of opportunity to get back into it. And if Avi gets back in there and we can pull up the product again, we'll certainly do that. You guys have been doing great with questions. Keep them coming, and we're gonna get into those in just a moment. But just to do a quick recap, most of us already know the importance of conducting the health checks. You demonstrated that in the poll by the people who actually have plans for it versus the ones who are considering it. But it doesn't change the fact that they are costly. Like George was talking about, there's the conducting the health check, but then you got to analyze the reports, and then there's remediation goes into that. Could take multiple weeks to months, depending on the size of the organization. And they are a snapshot in time. So they're something that has to be repeated, or you're left with sort of being blind to new issues that result when changes are made in the environment. We can help overcome those challenges. We actually do have a special offer for you all who are attending this session. If you want to lock in special pricing for 2025, this is the offer for you. All that we're asking is that you set up an introductory call with one of our technical specialists before the end of February. And then you'll be able to lock in the price of $8,500 for the rest of 2025. And the health check module includes not just the module itself, the deployment, but also the post-check analysis, remediation instructions, as well as the end user experience health check as well. So we'd love to talk to you more about that. If that's something that you're interested in, by all means, please let us know and we can help lock in that price. Now, let's jump into Q&A because we have a lot of questions that have come in. All right. Let's get up my...
Gary, I can take the questions that are too technical for George.
Okay, deal.
Yeah, I appreciate
first
that.
question is, do we offer POCs? The answer to that is yes. We do have a 30-day POC available. It'll be a small subset of the overall health check module, just so you can kind of see how it works in your environment. But yes, we do offer POCs.
And if I could put a finer point on that, not only do we offer POCs, but they're fully supported. So we help you get the product, the health check set up, and we'll help you analyze the results of the health check as well. So it's not we hand you a trial, but we'd like you to be able to exercise the functionality. The more people learn about the technology and use the technology, the more value they tend to have. So, and at the very least, you get some insights as to the health of your Citrix environment.
So this is actually a really great question. How will these work on an ongoing basis? In other words, how are changes to vendor guidance handled? This is a great question because we talk about ongoing health checks, but vendor guidance changes, right? And part of your environment changes, and you're not just looking at Citrix, but there's a lot of underlying infrastructure that goes into that as well. So the answer to that is the health check module will be updated on a quarterly basis. So as vendor guidance changes, we'll be updating the module with the latest vendor guidance. So you will always have the most recent vendor guidance available to run your health checks against. Thomas, anything that you would want to add to that? Or George?
That's one of the values of creating a software versus relying on consulting, right? You're mitigating the risk of human error, right? So since it's part of the product now, it'll be updated on every major release of the product as well, right? And the minor releases, so quarterly.
So George, I'm going to pass this question on to you. We've kind of covered it, but you can go into a little bit more detail. It says, will consulting services be needed to fix issues? That is part of the brilliance of this design, right? And how you helped develop this, because you're bringing in the things that you would do as a consultant, and you're providing that via software. Do you want to provide some additional color context around that?
Yeah, so the health checks, of course, and I think that's something that Thomas mentioned, they tell you where an environment is not aligned to best practice, but it doesn't just tell you, it then gives some instructions on how to remediate that. And yeah, a lot of the intelligence around the checks is coming from real life experience. As I mentioned, I've done a number of these health checks. I've seen environments that span thousands of users to hundreds of users. I've seen all sort of types of different technologies when it comes to supporting infrastructure and Citrix Cloud, Citrix on Azure, etc. So, there's just tons of different things that can go into a health check, and you're bringing all that into the health check modules. So it's all in one place, it's automated, and it's able to give you remediation advice. Now, if the organization wishes to engage a consultant to help with remediation, of course, that is also an option, right? So not every customer will feel confident of changing certain settings on their critical environments when it comes to Citrix. So it is also an option. Whilst we give the advice of here's how to remediate, the customer can choose to bring in an external consultant should they wish for that second set of eyes and hands. Did that answer the question?
No, that was perfect. You actually answered the follow-on question was, can they use help from consultant to help with that, or services, whatever the case might be.
Yeah.
So that was perfect. This next question.
Let me add one thing, Kerry. You know, remember part of the purpose of the health check module and having George work with us to put resolution instructions right in the product is to democratize a little bit of the Citrix expertise that's necessary for your typical health check, right? So I think, George, when you and I were first initially speaking, and I said, well, how much do you have to, how expert do you have to be to make the changes? And your response was, well, once I put the instructions in the health check module, you can have, you know, an IT generalist or an admin make the changes. You don't have to be a Citrix expert. The expertise comes into understanding what the resolution action is for the particular setting that's out of compliance, right? So we're taking that. You should be able to do these. We can certainly help you from a consulting services point of view. But the goal is to try to have the changes be able to be made by an IT generalist, not necessitating a Citrix expert.
Perfect. We have, so Mohammed, I see your question. You have a long list of, like a laundry list of items that you want to see if the health check checks for. I'm going to say we're going to follow up with you on that one, just because I want to make sure that we thoroughly vet your list to make sure that we answer each one correctly. So definitely we'll get back with you on that one. George, this probably would be more for Avi. Avi, are you back on? It's okay if you're not.
I'm back on audio.
Oh, okay, perfect. This was around automation. So this question is around, can automation be selectively used? We talked about they could choose, but I think they want to know if they can be really, really choosy with certain times they want to use automation and certain times they don't. Can you talk a little bit about that?
Did the question clarify if they meant for the Citrix Health Check and like resolution steps?
Yeah, I believe it's for the health check, and it's about the resolution.
Yeah, so as far as the type of automation that can be implemented, that can be, the client does have the ability to decide what automation and resolution steps are executed. You can have them be as simplistic as attempting to restart a service, but you can also have them be as complex to execute a particular script to carry out an action based off of the particular condition that was flagged as a failure.
Okay, great. Thomas, this question's probably best directed at you. This looks like it's just about monitoring in general. Does Goliath only monitor Citrix, or can it monitor other EUC technologies?
Really, we are help you with end user experience monitoring regardless of what platform you're using and where your workloads are. So we support AWS workspaces, ABD, VMware Horizon, as well as Citrix.
Okay, great. George, this question is probably best directed at you. This is around best practices. How often do you think health checks should be run?
Well,
I assume the question is, given that they have the automated module versus how often should they have a consultant do them? I'm filling in some blanks there.
Yeah, of course. So yeah, I typically recommend 30 days or more, but probably not less. I think if we look at the sort of software life cycle, and we talked about how, vendor best practice does change, but we will be releasing new versions of the module every quarter to accommodate any vendor changes to best practice. So at least 30 days or more is typically a good shout.
Okay. And are there any limitations to the size of the Citrix environment?
There is no limitation to the size of the environment, no.
Okay, great. You guys are doing good with the questions. Keep them coming. All right, Avi, this one's probably best directed at you. I touched on it a little bit. How long does it take to deploy? So let's look at it from two perspectives. I don't know, where this person sits, whether they're an existing customer or not. But can you talk talk about it from both perspectives?
Yeah, absolutely. So I'll first discuss if you're already a existing Goliath client. As far as for implementation and configuration of the Citrix Health Check module, that can be done in literally minutes. As far as for a organization that is not already a Goliath client, we would need to get the technology up and running. Typically, we're able to have a full implementation done in less than 2 hours. At that point is when we can then deploy the Citrix Health Check module, and from that point, it'd be just a few minutes to be able to get results as well.
Okay, great. And the last question here that we've got time for, and we've got a couple in here as well that are going to just require some individual follow-up, very specific questions about elements that are covered. But the last question, Thomas, I'm going to direct it to you. George, you had mentioned the Teams module. The question is, will there be other health check modules other than just Citrix?
Yeah, George, we're working on, for those of you in healthcare, an Epic module. We're working on a Teams module, as well as FS Logix and NetScaler. So there'll be a number of automated health check modules coming out in the next 12 months.
Okay. Fantastic. We are coming up on time. I just want to take a few minutes to wrap things up. Give you guys a chance to respond. If you have additional questions, keep them coming. It's okay. We will follow up with you individually after the session if that is best suited. So don't worry. You can keep asking your questions now. I do want to give you a heads up about some of our upcoming webinar sessions that we have. We have 2 webinars scheduled for February. The first one is another Citrix Troubleshooting Masterclass focused on troubleshooting remote workers. We're going to have John Bennett, who is a business unit director and IT leader at TRC Companies, talk about some of the problems, some of the challenges that they had with troubleshooting remote workers and how they overcame them using Goliath. So that one, the audience for that is really all levels of IT professionals, particularly in the Citrix space, but it could be any EUC technology, as Thomas talked about. It doesn't have to just be those of you who are over your Citrix environments. And in the second webinar that we have, for those of you on the session today that are in the healthcare space, it is a health IT masterclass. It's going to be focused on EHR speed and reliability and how it is foundational to clinician satisfaction. This is a great one for anyone in the health IT space, but also for your clinical and health IT executives who are probably not on this call today, but would be interested in that session. So if it's something that you think they would be interested in, feel free to forward that on to them as well. And that one is on February 27th. And we'll have links in the chat as well to register for those. Again, don't forget, we do have a post-webinar survey. It'll take just a minute to fill out. It's just a few questions, but it does help us to make sure that we are aligning these sessions to things that are valuable and meaningful for you all. If you are interested in a free POC or a trial, again, we have links that have been dropped in the chat. We're happy to help you with that. We can give you a personalized demo as well, and we have free access to the end user experience reports that we've showed you as well, so that you can get a taste of what that looks like. And if you're on the call and you're a consultant, we do offer consulting licenses as well. So with that, I do want to thank George and Thomas and Avi for joining the session today. I thought it was really great. I thank the audience, all of you who participated. You were really engaged in the question and answers. Love to see that. It makes it validates that we're hitting a topic that's meaningful for you all. And we will see you all on the next session. So thank you very much for attending, and enjoy the rest of your day, everyone.